The death toll in Gaza has surpassed a grim milestone. According to local authorities, more than 60,000 Palestinians have been killed since October 2023. And humanitarian groups are warning that number will drastically rise if aid continues to be blocked from the region. Images from the ground showing Palestinians rushing to gather life-saving supplies. The United Nations warns that Gaza is on the brink of famine as aid into the enclave has largely been restricted. Over the past few weeks, health authorities in Gaza have said 147 people have died due to hunger. 88 of those are children. With international criticism growing, Israel has announced plans to increase access to essential aid. Doctors Without Borders has teams on the ground in Gaza, and here with us now is Executive Director of MSF Canada, Sana Beg. Thank you so much for being with us. I want to start with the haunting images we've all been seeing online coming out of Gaza here. You have teams on the ground. Describe what they're seeing.
Sure. We have about 1,000 Doctors Without Borders, Medecins Sans Frontières staff that work in Gaza, mostly locally hired Palestinian staff. And in addition to that, around 35, 40 or so internationally hired staff that come in for varying degrees of assignments to support with the existing healthcare needs in the region. This also includes, as of today, about 5 or 6 Canadians that we have on the ground in Gaza as well. And there is so much being discussed about what is there in Gaza today. I'd rather us talk about what is not there today in terms of what our teams are telling us. What is not there is safe passage to be able to access the humanitarian aid and the critical medical care that organizations like ours are providing. There are no secure passages for civilians, for patients, for healthcare workers to be able to safely arrive at hospitals. Many people delay doing so for fear of being attacked, being harassed, or simply being denied to be able to reach hospitals. There is no functioning healthcare system. You have at least 17 of the 36 hospitals destroyed, barely functioning, or completely damaged. There is no secure mechanism for a supply chain to exist. You have hundreds of trucks waiting on the other side of Rafah crossing, wanting to come in, but there is still no mechanism in place or a willingness in place to allow those to come in. Simply put, there is also no electricity, there is no oxygen. These are sporadic and few and intermittent in the hospitals that we work in. There are no clean sheets, there are no proper equipment required. Our staff, you have to remember, in these past 2 years, 1,500 medical professionals have been killed, according to the World Health Organization. We've lost 12 of our own colleagues just in these past 2 years alone. What does that mean for the people? Thank you. What does that mean for those that remain? They are working unending shifts, 48-hour shifts with no one to replace them. They are working on empty stomachs because there is no food, there is no water, there is no waste management system, there is no sanitation. So in the conversations that we're having today, to paint what is a very real yet very grim picture, this is the portrayal that we receive from our staff. This is what exists in Gaza. And what also exists simultaneously, after nearly 60,000 people have been killed, is clearly a genocide, is clearly ethnic cleansing. And this is something that we have come out as a global, credible international organization to say that what we are seeing on the ground are the clear markings of these. All red lines have been crossed in Gaza. All international laws and conventions that protect humanity and civilians have been crossed. This is the situation today.
Is your team able, they're doing life-saving work in Gaza, operating on those who've been injured critically, might I add. Are they able to get the necessities in there themselves as part of an organization that's known worldwide?
We are one, alongside many other actors in the aid space working in Gaza, dealing with repeated red tape, blockades from the Israeli government for routine medical asks that we have. We were talking earlier about the need for basic painkillers that we need, external fixators for those that have lost limbs or need rehabilitation. Those things are stuck at the border. They are stuck at the border. We have been rationing out where possible diabetes medication, asking people to come back in 2 weeks or so to see if we have another ration coming in, if at all. The situation is quite grim and quite deadly. And our teams are forced to make choices such as this every day. A Canadian colleague of ours who is in Gaza today tells us that they often have to make a choice between who is malnourished enough to be able to provide the treatment that we are giving for malnourished patients.
Are you getting a sense of the rates of malnutrition? Are you getting a sense of what that looks like, or is it hard to collect that data?
Well, with the IPC now officially classifying what we're seeing in Gaza as famine, we're definitely seeing numbers to substantiate that. So just in the past few weeks alone, from the ages of 6 months to 5 years of age, we have seen a near doubling, if not quadrupling, of patients coming in that age band requiring support for malnutrition, severely acutely malnourished children, pregnant women coming in as malnourished. And the numbers have been increasing steadily. As of today, what our teams are telling us is that every single day we're admitting at least 25 patients every day specifically for treatment for malnutrition.
Okay, I want to ask you right now, what's your message to the international community, the Canadian government, and people at home watching?
Sure. To the Canadian government, Canada has been taking some actions that we welcome. They have publicly denounced violations of international humanitarian law. It is time that we back the words with real actions. It's time for the Canadian government to look at what are those tangible measures that can be taken against Israel. Consequences, immediate consequences, need to be imposed on Israel, either unilaterally through the Canadian government or Canada alongside other global partners that exist. We also need to ensure that Canada stops engaging in any sort of an arms trade that enables the genocide of Israel that's taking place in Gaza.
Okay, it's clear that something does need to be done. Sana Beg, we thank you so much for coming in today.
Thank you for having me.